Vielen Dank, Frau Vizepräsidentin.
Thank you very much, Vice President. So that brings us to speakers on behalf of political groups, and our first speaker is Mrs. Franson for the European People's Party. You have the floor.
Thank you very much, Commission, and thank you very much for the at the beginning of the corona pandemic, no one could predict the horrible consequences of this tsunami that has claimed so many lives. And difficult choices had to be made over who would be hospitalised, often based on age criteria. Choices that we have not had to make since the Second World War. And it is the generation that tried to build our welfare state that had its lives cut short. But the right to long-term care is enshrined in our European social pillar. But let's be honest, the first wave, we were not ready to tackle a crisis of this type. But it is not time to set up public courts to identify who was responsible. But we do need to learn lessons. We need to find a better balance between well-being and physical health, between safety and mental well-being of our most vulnerable people. We can't limit visiting rights and the right for people to have, say, a dignified goodbye. Human warmth is the best medicine for the vulnerability that people with dementia suffer from. And the same applies to the disabled and to young people in youth centres and also older people getting care at home. And when we failed, the carers gave their very best. They bore this human tragedy on their already overburdened shoulders. A sector which has been suffering for years, which is underfunded and lacking in recognition. And colleagues, this is why I applaud the initiative from my colleagues Francis Fitzgerald and Denis Radke for a European carers strategy, because this will create better working conditions so that we can provide better quality care. Our caring heroes deserve more than just applause. And let us now take concrete actions. Thank you.
On behalf of S&D, Mr. Majorino. 2 minutes, please.
Microphone, please. We have seen a tragedy within a tragedy, which we can no longer ignore. This is why today's debate is important. Over half of the COVID deaths happened in long-term care facilities, in aged care homes and homes for people with disabilities. People were left alone, which is a shame, and often healthcare workers did not have protective gear, access to tests and safety information. This happened in many member states of the European Union, and even in my region of Lombardy, where a black page in history was written with the failure of the healthcare system and a skyrocketing death rate. This happened in aged care homes after the crass decisions are taken, and we need to shed light on what has happened, not only to identify specific political structures which left people behind, but also to ensure that we do not repeat this scenario in the coming months. So we need a more social Europe, and the Commission needs to get more involved and needs to be careful in the right to healthcare and assistance. We need greater investment, new choices to face the second phase of the emergency without repeating the huge mistakes of the past. We need to see how we can give these services in future by helping people in citizens associations and unions. People who live in aged care homes and people who live in homes for people with disabilities also need to get attention from our healthcare system. Thank you.
On behalf of Renew, Mr. Pislaru, 2 minutes.
Thank you very much, President, Madam Commissioner. In this sad story of COVID-19, the situation of long-term care facilities is one of the most disastrous chapters. Many member states in the EU have committed mistakes. We should admit it. And I hope that one day we shall have an investigation to show what really happened and why these centers were turned and they continue to be infection centers. We are talking about the most vulnerable citizens, people who need permanent care, people with disabilities or elderly people that were abandoned face to this pandemic. Having no emergency plan, the carers have made tremendous efforts. And let me thank all those who stayed with them confronting the danger. But the rate of mortality was very high. The Commission should work with the Member States to identify solutions in two directions. Well-paid and well-trained carers and modern centers where the vulnerable people can receive the care they need in safety. Renew Europe. Our political group struggles for rethinking care and care facilities in the management of the communities to make sure we shall no longer have abandonment of vulnerable people in institutionalized systems. In the future, we should substantially invest in creating access and opportunity for any EU citizen in need to benefit care sustainably by direct access or in the community where they live. Last but not least, a modern industry of care at EU level can be beneficial for those who enjoy its services and also by creating jobs and a beneficial social impact. A clear strategy on care at EU level is an imperative, Madam Commissioner. Thank you.
On behalf of ID, Mr. Heil.
Herr Präsident, liebe Kolleginnen und Kollegen!
President, colleagues, COVID-19 scares us, and that's not surprising because we wake up with it and go to sleep with it. It's everywhere. Now, the measures that we're taking to fight the pandemic, however, are causing far more damage than the pandemic itself. And I'm not only talking about the economic damage that's being caused. I'm talking about measures that affect the most vulnerable in our society, those living in care homes. In Germany, 1 in 2 people who died of COVID died in a care home. And which measures have the government delivered? Well, what they've done is isolated these people. They have implemented a contact ban with their loved ones. This measure hasn't saved anyone, quite the opposite. It was inhuman, it was cruel, and it cost human lives. During difficult times, these people need the love and closeness of their loved ones. And the measures were wrong because the people's loved ones could have been with them. We know that now. So these measures were inhuman. And then what about the heroes of the pandemic, our carers who were at the forefront of the fight? What did they receive? Applause. What else? I mean, applause is great. They've been told that they're valued. But was that it? The German government didn't do anything. Has the situation, the fact that they're being praised, has that changed anything? They were in a difficult situation prior to the pandemic as well, and they earn €2,500 gross a month, and they have to give their all in their work. My wife works as a carer, so I know the problems there. What we need is a policy that's human in nature. Thank you.
On behalf of Greens/EFA, Mrs. Metz, 2 minutes.
Merci, Monsieur.
Thank you very much. It is unacceptable that during this crisis, the most vulnerable citizens, whether it's as a result of their age or their specific needs, suffered so much, suffered more than others during the crisis, and that in total silence, without an adequate response either by member states or by the European Union. And Nevertheless, the WHO did already sound the alarm in March with regard to the dramatic situation of people in long-term care facilities, highlighting the fact that half of the COVID-19 deaths were taking place in these establishments. Isolation, a shortage of equipment, a lack of medicines, a lack of tests have turned these institutions into hotbeds of infection where healthcare measures could not be guaranteed. Many member states did not even take into account the deaths of these people in their statistics because they wanted to hide the reality of the situation. And I call upon the European Parliament to set up a committee of inquiry to shed light on what happened. The inhumane treatment, violations of human rights cannot remain without consequences, and it is our responsibility to give a voice to these people and demonstrate that there are no second-class citizens in Europe. And I'd like to conclude with two questions to the Commission. Do you agree that it's important to apply Article 19 of the rights of the disabled in Europe, and in doing so channel funding towards support for life outside institutions, which makes it possible to respect the freedoms of these people? Thank you.
On behalf of ECR, Mrs. Rafalska.
Panie Przewodniczący, Pani Komisarz.
President, Commissioner, during the pandemic, which is still ongoing, and when we've seen so many deaths, unfortunately, the most difficult situation has been for older people in these aged care homes. People who are most ill are most affected because they face a higher risk of dying. We've seen it's a 15% death rate in older people, and it's even higher in these homes. This happened in many European countries, in France, Spain, Belgium, Italy, where mortality rates held 17 or even 25%. In these homes, many of the healthcare workers also fell ill because of lack of protective means. So this led to a discrimination against the patients. The worst case was in Spain, where they had to choose who received care and who didn't. So people needing long-term care didn't receive the care they required. Europe speaks about solidarity, and in such a Europe, we cannot see these situations. We cannot have a dilemma of who will receive health care and who will not. We have seen an increase in coronavirus cases, and now we're entering the flu season. How are we going to face the situation of those who need long-term care? I hope that we will learn a lesson because we don't have much time. Thank you.
On behalf of GUE NGL, Mrs. Konečná. 1 minute.
Mr. Chair, Madam Commissioner, colleagues, ladies and gentlemen, thousands of inhabitants of these long-term care facilities have died from COVID, but many other thousands died due to isolation, fear, solitude, which made their state much worse. We shouldn't forget that. These people could have been living for 20 more years. They could have enriched the younger generation by their presence, but they are gone. And I am horrified a little bit when you say that you will be creating new action plans and strategies, because the system of care has been existing and has been underestimated and neglected for the last 20 years. And the Commission is not blameless, because many times we allow their privatization. All this money that you invest into NATO and military issues would be much better used for long care facilities, action plans, strategies, talk, that won't help us, because the staff and the people who we care for, those are the people that have to be on top of our minds.
Thank you. However, please mind your vocabulary. For non-attached, Mr. Comín y Olivares.
Gracias, señor presidente. Sabemos desde hace años que uno de los mayores retos, si no el reto mayor de nuestros sistemas.
Thank you, President. Well, we have known for a long time that one of the major challenges that we face in our care systems is isolation of people. Now, we need to deal with the challenge that we face at the European level, but we need to deal with the issue without taking people out of their family environment. But the problem is that the virus now has made things much more complicated. In order to protect the elderly from the pandemic, the medical authorities have come up with dramatic measures for isolation and have restricted the social interaction of these elderly people, both in care homes and at home. And that is a major contradiction. In addition, those who work professionally in long-term care facilities have found themselves working alone against COVID, and they're very unprotected. They need better working conditions and better protective equipment. But first and foremost, let's not wait any longer to reform our residential care system, because it's very far from the principle of intergenerational solidarity. Thank you.
Our next speaker is Mr. Kosa, 1 minute and a half.
Kedves kollégák, a járvány mindennél jobban megmutat.
Colleagues, the pandemic has shown us that those who are in long-term residential care are in a great deal of danger. This is also the case in Budapest. And unfortunately, Budapest is a good example as to how, for political reasons, the otherwise correct measures which were decided by the government didn't do what they were supposed to. In one particular care home, 21 employees and dozens of patients became ill. 55 of these people passed away. I would say that it's the left wing rather than the government that bears responsibility for this. But when we're talking about health, we shouldn't think along party political lines. I would call on colleagues, regardless of your political convictions, to support national governments 100%. Now we are at the heart of the second wave, and the danger is still there. It is not too late for us to work together to save lives. Thank you.
Mr. Briglas, 2 minutes.
Hvala za besedo.
Thank you, Mr. President. I welcome today's discussion, but regret the fact that we're having it several months too late. This is confirmed by the WHO, whose data clearly shows that during the first wave of the pandemic, more than half of the victims were residents of long-term care facilities. This is a tragic statistic, and this situation should never have occurred. Unfortunately, neither the Member States nor the EU have found the political will to thoroughly investigate the causes and prevent any future mistakes. The past few months have exposed the deep roots of ageism or hostility towards the elderly. While the EU's population grows older, aging remains a topic to be avoided, to be treated with prejudice and stereotypes, often equaled with disease and disability. As a consequence, a large number of the elderly are socially excluded. They are viewed as a social burden, while long-term care facilities are not the picture of a loving home, but of a last stop on the path of life. Human rights, including adequate healthcare, should be guaranteed to everyone in all stages of life and without discrimination. It's unacceptable that long-term care facilities across Europe were left to their own devices, and forced into becoming a kind of improvised hospital without adequate equipment and trained medical staff. That is why I strongly support the Commission President's commitment to form a comprehensive health union, but this is not enough. Together we need to do more for intergenerational solidarity, to ensure the fight against age-based discrimination and to ensure the respect of the rights of the elderly. We need a common European framework for long-term care services based on human rights and social solidarity. I call on the Commission to develop a common framework for rules and quality standards mandatory for all member states. It has to be based on a holistic approach to people's needs. In addition to healthcare, it has to offer social and psychological support in a stage of life that, with the right policy, can be just as beautiful and fulfilling as any other. Thank you.
Mrs. Trier-Lenore, 1 minute and a half.
Merci. Thank you very much, President. The quality and safety of patients should always be our priority. Residents of long-term care facilities, particularly in hospital facilities for dependent persons, were hit very hard by the COVID-19 crisis, affected by the illness, but also the isolation of confinement. As you've said, Commissioner, we need to learn the lessons of the crisis and take the necessary measures. We need to strengthen supervision and preparation of these facilities. This is something that we need in Europe, and is a way for us to strengthen the European Disease Control Centre. We need to look at the organisation and structuring of these long-term care facilities. And that is something that the member states need to do. We also need to improve training and working conditions for staff, working together with Commissioner Schmidt, as you have said. And we need to pay tribute to the professionals and family members who are helping these vulnerable people. Thank you very much for starting this debate. It's a necessary debate. It's not just a question of health, it's a question of human dignity. Thank you very much.
Mrs. Laporte.
Monsieur le Président.
Thank you, President. Patients in long-term care paid a price during this pandemic, and they also paid the price of being isolated. We're talking about people with physical or mental disabilities who need constant care. COVID-19 only stressed how vulnerable they are, as well as people with ongoing cancers or other diseases, including Alzheimer's. COVID-19 affected old people in a disproportionate manner, as well as people in long-term care. According to authorities, between 30 and 60% of deaths of COVID-19 happened in these establishments during the beginning of the pandemic. Many challenges had to be overcome in order to give care to these people with long-term problems, while at the same time caring for people facing the pandemic. We need to ensure the well-being of these people. People were isolated, doors were closed to these homes, and people were left alone. Healthcare workers wearing masks couldn't even show their face. Social distancing of 1.5 meters meant no physical contact as well. Meanwhile, people with non-urgent problems have not been able to access health care, and we cannot continue this indefinitely. We need to find a solution. We need to prepare areas for people who are in isolation to allow for visitors, as well as better protection for healthcare workers. This has to be available in every hospital. A video from Mrs. van der Leyen telling us to wash our hands will not solve things. We need to completely upend the healthcare system in Europe in order to be better prepared in case of a new crisis. Thank you.
Mrs. Spurek, 1 minute.
Thank you, Mr. President. No access to healthcare services, no infection protection measures and testing, isolation from society. But we did not only leave the residents of long-term care facilities without necessary support. We forgot elderly people and people with disabilities have the right to live independently and be included in the community that is their fundamental human right. The right to independent life is not our moral obligation, but also, or above all, a matter of compliance with the Convention on the Rights of Persons with Disabilities that was ratified not only by all member states, but also by the EU. We need to stop delaying the transition away from institutions now. Thank you.
Mrs. Juriš Nicholsonova, 1.5 minutes. Your mic is not on.
Ďakujem veľmi pekne. Poprvé, chýbajú nám
Yes, thank you very much. We don't have EU-wide comparable data from member states. We've got statistics, but we do know that 30 to 60% of the deaths were in these long-term care facilities. And even before the pandemic, there was a lack of monitoring of illnesses. It wasn't possible to get timely reporting, and that made it difficult to prevent deaths. People with neurological disorders like dementia need special care to make sure that they're not asymptomatic, and that is why we need monitoring systems. And of course, there's another problem, which is the lack of staff. That's something that we've heard over and over again. And the situation on the labour market is that these are very low-paid jobs. They cannot respect 2-meter distance, and they do not have the necessary protective equipment. In the Slovak Republic, we had a lot of cases where within the facilities, the patients were being tortured. They were locked into their rooms. They couldn't have any visitors. And it was like torture. We need comparable data so that we are able to protect the residents and also the staff.
Oui, merci, Madame.
Thank you, Commissioner. People who have handicaps or autism who are already isolated were isolated even more. People who are retired were isolated. Healthcare workers were died. This is the result of COVID-19 on the healthcare system. We're told that healthcare is not a competence of the Union, but under the Commission, national budgets were strained. People taking care of a country need to prepare for chaos and death. Contrary to what the Commission said, this has nothing to do with supply and demand. This doesn't make any sense when we speak about healthcare. This is organized mistreatment that has privatized our public healthcare systems. Dear colleagues, we measure the state of health of a society by the way they treat those who are ill and face diseases. Thank you.
Mr. Papadakis is in the chamber.
Η απαράδεκτη κατάσταση σε γυροκομεία και ιδρύματα μακροχρόνιας φροντίδας.
Well, it is unacceptable that long-term health care is so poor, and this isn't something that is only the case during the pandemic. This was the case prior to the crisis as well. The health policy that has been promoted by Noia Demokratia and Syriza, political parties in Greece, are measures that lead to healthcare structures having few members of staff, and what it means is that large businesses make profits. So obviously we've had major outbreaks in these long-term care structures. It's both workers and patients who've been affected. What we need to ensure is that healthcare is improved, because at the moment these long-term care homes are used for people who can't be dealt with in hospitals. So we need preventive measures. We need wide-scale testing, and we need people to take their responsibilities on board. They need to provide free services. Thank you.
Mrs. Lukaczewska, 1 minute and a half.
Dziękuję bardzo. Szanowni Państwo, miliony osób starszych, terminalnie chorych, niepełnosprawnych.
Thank you very much. Well, millions of elderly people and people living with disabilities live in long-term care facilities. Many of the residents and workers are women, and many of those who work there work in many of these facilities at the same time for financial reasons, and that made it much easier for the virus to spread. There are problems in terms of protective equipment, and there are problems in terms of numbers of staff, and all of that has contributed to high fatalities in these facilities. Let's not forget that there have been many restrictions put in place, and that means that a high number of staff no longer go to work because they have to stay at home, for example, to look after their own families. So they don't have equipment, there's a lack of staff, people are low paid, and without improving these things, the situation in long-term care facilities will not be improved, because often it's very basic things that make a difference, such as, for example, gloves. 2,500 heroes, a colleague has said recently. Those are the numbers of people in Germany and the countries of Central and Eastern Europe who have been infected. This is shameful. It's not in the 21st century that these kinds of things should be happening, Commissioner. Without the support of the Commission, the situation will continue to deteriorate.
Commissioner, imagine you had lost your job and your health was under threat. We all have our own story, our own tale as to how COVID impacted on our lives. Now, in care homes around Europe, they really were dealt a severe blow. They were hermetically sealed. No one could get in. My own sister lives in a care facility for months. She was not allowed any visitors. The odd phone call, waving from the car park. That was the case for many families around Europe. For months they weren't able to visit their grandparents, parents, sisters, brothers. They weren't allowed to hug them. No human affection was allowed. Now we all know that we are facing the so-called second wave. We need to pull together to tackle this crisis. The Commission needs to ensure that there is better coordination so that there is not disarray between the Member States. We need precautions and provisions in place to ensure health and safety at work, that the right resources are available for all at the right time for those working in care homes, in different facilities and in hospitals. Everyone is entitled to enjoy health and safety at work, and everyone is entitled to be surrounded by their loved ones. Thank you.
Mr. Cañas, 1 minute and a half.
Thank you, President. Commissioner, look at the moral benchmark of a society, if we are to take that benchmark as the way we treat our elderly, then we have to confess that we have failed. We failed to provide what our senior citizens needed and deserved. They died alone, abandoned, neglected, vulnerable, worried, in fear. This health crisis held up a mirror to our society. We have seen the best and worst in our societies, our strengths, but also our disasters. Now the time has come to offer a response to the problems detected. Never again can we allow our older persons to die alone in fear and anguish. Commissioner, I suggest that we all pledge together, MEPs and commissioners, that we pledge to draft a charter of rights for older persons, promising to them that never again will they be abandoned alone. We will look after them in dignity and love as they deserve, always and through to the end. Thank you.
Mrs. Tovaglieri.
Thank you very much, President, Commissioner, colleagues. In Italy, as in the rest of Europe, the impact of the first wave of COVID on people in long-term care has been extremely serious, and that has meant we have needed to reinforce all our operative protocols. We need to ensure that we protect elderly people and people in long-term care. We need to ensure that there is sufficient quantity of staff, and we also need to ensure they are properly trained. They are at the front line in helping the most vulnerable patients and their families. I'd like to thank once again all of those professional groups that have worked so hard and have allowed Italy and Europe's nations to survive this very dramatic moment. There are many young health workers who have put energy and passion into their work. They are our future. We must invest in them to ensure that we are able to deal with any upcoming wave. And I hope that they are able to overcome the stress of the first wave. We need to ensure that there are enough incentives and funding for training and career development for these young health professionals and nurses. We need to ensure that their indispensable work is supported. The five-star movement is called these people heroes, but nevertheless, there's been a short-sightedness in actually engaging in proper long-term programming. Over the next 5 years, we will be short of 10,000 doctors, but at the same time, universities have stopped their open competitions for assuming new medical students. So this is going to harm, over the long term, both doctors and patients. I'm sure that the European Union can make a difference on this front. That's why we are asking for a concrete and practical contribution to help health professionals in Italy and the rest of Europe. Thank you.
Mr. Goiking, 1 minute.
Thank you very much, President. First of all, my thoughts are with the victims of COVID-19 and their relatives. And we must apologise, because these problems that we had in long-term care homes have been known for decades. Lack of staff and equipment, understaffing, lack of care. Not through the will, but rather of the staff, but rather through destruction of jobs and incorrect documentation requirements. That's my background. I know what I'm talking about. We had a concept in Germany, KA21. What we need is people to have independent lives. In the KA21 concept, we set this out for years ago. We had a lot fewer casualties and fatalities. So let's not politicize care. I said to care personnel, care for those people the way you'd like to be cared for. If you do that, you'll be doing nothing wrong. And I think that's something that we all need to take on board. Thank you.
Mrs. Rodriguez Palop.
Gracias.
Thank you. We all know that COVID hit care homes, long-term care facilities, particularly hard, particularly facilities for the aged. Information is fragmented because some authorities have not supplied the data required. That is the case in Madrid in Spain. And we're seeing that it is at the front line of the second wave in Spain. We have seen thousands of deaths in Spain, 66% in senior citizens' homes. Now, care facilities are under the authority of the autonomous regions in Spain. Thousands died without their family members around them. At some time, we will need to take stock. We will need to know who died, how they died. Their carers, mainly women, were left unprotected without the equipment needed. Now, in March and April, people from retirement homes were being turned back from hospitals. We know that the Labour Ministry drafted protocols. What happened to them? The situation was worse in Madrid because we have seen advanced privatisation in the healthcare sector there. I do apologise for running over my time.
Mr. Kolakušić.
Colleagues, for almost a year since the first pandemic campaign started, we still allow for an illegal and unscientific manner to be used to determine the number of people who died of COVID. People who died of strokes, of heart attacks, are declared as COVID deaths simply because 28 days before their death they were positive for COVID, although they did not show any symptoms. If we were to apply the same method to common cold, we would have tens of thousands of deaths. This is a campaign of fear. We quarantined the elderly in Croatia and in the rest of Europe. Over half of the people who died in the nursing homes. And on the other hand, so many elderly people visited Croatia and they swam in the sea and they did not get sick. Thank you.
Questa Casa, 1 minute and a half.
Grazie, Sur President.
Thank you. Unfortunately, the COVID-19 pandemic has hit everyone. Some people have lost their jobs, who lost their loved ones, who got ill. Others passed away because of this virus. The word is different nowadays, but this virus cannot win us over. We need to win it. We are focusing today on the facilities we offer to our elderly, those who unfortunately are more vulnerable, particularly those who have dementia. So COVID hits them more aggressively. In Europe, we saw a lot of cases in long-term care facilities. I understand it's not easy to control this virus, but I believe that also on a European level we should assure the best standards in every facility, in every hospital. After more than 7 months since the start of this pandemic in Europe, we lost a lot of people, but we also learned a lot of lessons. I appeal to the EU Commission to assure basic standards in all long-term care facilities and in every hospital in Europe. Thank you.
Mrs. Fritzon, 1 minute and a half.
Thank you very much for giving me the floor, President. In all of our member states, the pandemic has led to serious problems in health care and long-term care. The staff working in these facilities are women in the large majority, and they have made huge efforts under terrible conditions with a huge burden of work. The situation is different from country to country, but the crisis has brought out that we have problems that we need to take responsibility for. All member states have to do their share. They have to take responsibility because the welfare system requires more resources. We need to have more staff in health and social care. We also need to take responsibility to ensure that we have good working conditions and good quality contracts. But the EU also has an important role to play. The EU has a responsibility to coordinate and bolster efforts to try and help public health and the health system. And I welcome the proposals that the Commission has made. I myself come from a country with a strong welfare state, but in Sweden too, there's a need for a major effort in response to this crisis. My Social Democrat-led government has decided on further efforts on health care and old age care, and that is exactly what should be done in all member states. We need to build a stronger EU, a stronger welfare system, so that we all should take our share of responsibility. Thank you for the floor.
Mr. Andrews, 1 minute.
Thank you, Chairperson, Commissioner. It can't go unnoted today that the accidental but most notorious long-term care facility in the EU burned down last month in Moria, in Lesbos. But that is a debate we've already had. Today, I want to note that at the very beginning of the COVID outbreak, a lot of mistakes were made in relation to nursing homes, particularly around the wearing of masks, advice about allowing visitation, etc. We've learned some very hard lessons, as other speakers have said. More than half of deaths in the EU, according to WTO, were in nursing homes. And in this second wave, as appears to be apparent, I think we should also concentrate, as others have said, on people living in long-term residential care with physical and learning disabilities, of whom there are very many. And I received a note in an email from a constituent, which I want to quote. We brought our special needs son back to his residential home last week, as my wife and I are totally drained after 5 months of cocooning. As per rules of the residential home, he has to spend 14 days in isolation in his bedroom, which underlines the distress for both parents and for patients. So I wish to make 2 quick points. One, that we have to make sure that we fund staff with PPE, with testing, and with overtime cover and decent wages. And we have to partner with families and listen to older people who know better than anybody else the balance that has to be struck between the loss of emotional and physical contact and public health on the other hand. Thank you, Chair.
Mrs. Lacapelle, 2 minutes.
Long-term care, that is, say, care homes, that's at the heart of what we think about COVID. In France, elderly people are 95% of the fatalities we've seen. In France, what have we done for old people? Nothing. Budgets have been cut, costs have gone up, more precariousness. The government is creating a new branch of social service. When it comes to hospitals, where thousands of beds have been cut in 2019, staff have been cut, funding has been cut, care staff have been venting their anger in the streets. The European Commission, between 2011 and 2018, asked the member states 63 times to cut their health spending. You're responsible for that. When it comes to care homes, old people have been abandoned. There's been a lack of equipment because of the cuts. The elderly people have been left alone. They've been robbed of their loved ones in their last moments many times. things are getting worse. By 2060, the number of dependent old people will double. We need young people not just to look after old people, but to carry on, take on the baton. The situation of care homes leads us with two conclusions. We need more assistance for old people, not just economically and medically, but in terms of social and family inclusion. And secondly, we need to have a European approach which supports old people.
I apologize, Mr. Lacapelle, of course. Our next speaker is Mrs. de la Pisa Carrion.
The situation in care facilities in Spain was devastating. Our older people were locked up. That is no metaphor. They were literally locked behind bars, banging on doors. Their carers were unable to do anything. They were ordered by the government to prevent people from leaving. The media has not properly reported the truth. It remained silent, and these people died neglected, cut off from their family. How could this have happened? What are the values of a society that allows its parents to die? These are the people at the heart of our families. This is one of the greatest threats that any civilization can face, dehumanization.
Mr. McManus.
Thank you, Vice President. This is a very important issue for all of us.
There are no Irish interpreters available. COVID-19 outbreaks in care facilities have had a devastating impact on all our communities. In Ireland, we have seen many clusters of COVID in nursing homes with tragic results. An example of this in my own constituency would be Jalgan Nursing Home, a privately run facility in Dundalk. Last April and May, almost a third of the residents in that nursing home died of COVID. This case really highlights the lack of state oversight in my member state regarding privately run and profit-driven care facilities, leaving them vulnerable to mismanagement. There are many similar examples, and we need a public inquiry on such matters to learn from this pandemic. And most importantly, it shows we must, as a society, commit to universal public health and social care that will better protect our communities from communal diseases such as COVID. Guramayigiv.
Mrs. Weiss, 1 minute and a half.
Thank you. Man skal være et
People must be very unaware. If you're not aware of all these situations around the EU, residents of care homes have been let down. With years of experience in the healthcare sector, I know what it's about. These differences are national.
Socialområdet et nationalt ansvar, både I forhold til kvalitet, kvantitet og ikke mindst økonomisk. Jeg fornemmer lidt på debatten, at vi her I parlamentet kunne fristes af at sætte et monster af papirtiger og metal og tunge rapporter.
I apologize. There's no English translation.
This is not English, this is Danish.
Yeah, but there's no English translation, interpretation.
So let me know.
Can you continue? Hopefully the translators will start to translate.
Okay, I will do so. Jeg fornemmer.
I see in the debate that in the Parliament we could be tempted to create paper tigers with lots of reports and full of demands. So, because trying to follow up the matter, we try to show leadership. We can let go these paper tigers in this debate, where we're trying to name and shame countries and all these very skilled healthcare people who are doing great work every day. and it doesn't benefit people in the care homes. The EU needs to be a coordinator and a facilitator for much more cooperation across the borders so we can learn from each other and help each other. What will the Commission do to set this ethical commitment going, and so that citizens can notice it in their everyday lives? Thank you.
Thank you, and I apologize for the technical issues. And Danish is a beautiful language. Mr. Angel.
Thank you very much, Mr. President. Interruption de soins.
Interrupted healthcare, solitude, excessive mental burdens, lack of PPE, a lack of staff in long-term care facilities, particularly in border areas due to the closing of borders. These are situations that people with disabilities and elderly people have faced over the last few months. The impact of the crisis on our populations could have been limited if Member States had given Europe a chance to impose itself in coordinating a crisis management policies. Europe can collect data, it can exchange best practices, it can preempt risks and act in a coordinated manner. So that's why the Socialist and Democrat group supports the idea of a healthcare union. Here are our demands. Make the social Europe a priority in the European semester, alongside all of the financial issues, so that we can contribute to refinancing healthcare in Europe. We need a disability strategy that provides answers in the middle of a healthcare crisis like this one. We need to review Schengen so that access to cross-border healthcare and professional mobility is guaranteed. And we need to finance the creation of local healthcare facilities, particularly in rural areas.
Mr. Juržica, 1 minute.
Ďakujem pekne.
Thank you. According to the World Health Organization, in certain developed countries, up to 80% of corona-related deaths are linked to the long-term nursing houses. Among individual member states, however, there are big differences in statistics and reportings, especially as far as death reporting goes. Although there is an existing methodology how to register corona-related death, without good quality and comparable data, it is impossible to decide. Without this data, we are not able to distribute the limited number of vaccines or efficient medications to people who need it most. Even a small mistake in reporting may expose a large number of the most vulnerable people and cause their death. Thank you.
Mr. Hetman, 1 minute and a half.
Dziękuję, panie przewodniczący, szanowni państwo.
Thank you, President. Ladies and gentlemen, first of all, I am happy that we're having this debate on this very relevant subject today. The situation in long-term care facilities has been bad, particularly in the beginning. In some countries, the death toll was about over half the total number of victims of COVID. People in nursing homes are a high-risk group, but we have reports that many changes were made too late or were insufficient. Now we need to draw conclusions from the dramatic events, because now it is obvious that the pandemic is here to stay, at least for some time, and we have a long struggle ahead of us. In order to succeed, we need coordinated European efforts as well. We need to identify the biggest challenges, and we need to decide how we can support member states in crisis management in such facilities. We need a good supervision system so that information and data can be provided and new clusters are detected the earliest possible so that we can contain the virus. Thank you very much.
Mrs. Serdash, 1 minute.
Thank you, President, Commissioner. Eu vou falar em português.
I'll be speaking Portuguese. Residential care units have ended up being one of the major issues of this pandemic, particularly preventing and controlling COVID-19 infections. It's not just a question of healthcare facilities, of course. We have to remember that one of the key factors is the conditions of the workers in long-term residential units. They need to have necessary training and access to the right kind of equipment. They also need to be tested in a timely manner. This challenge requires coordination. We need to protect our elderly. We need to ensure that professional care workers have the training they need. We need to intensify testing, and we need better coordination, national level, regional level, and European level. This Parliament has asked for this already in the last plenary session. We need to take care of the most vulnerable people, but we also need to take care of those who look after them.
Mr. Yaki, 1 minute.
Dziękuję, panie przewodniczący.
Thank you very much, Mr. Chair. Long-term care houses are, first of all, the people, the carers who are working there. They are very special people. First of all, they are not earning a lot. And secondly, the work in that period of time was a great threat to their life, and they still stayed there, and they were working for the seniors, for the disabled, for the sick. So it's a special kind of solidarity, also European solidarity, that we should care about, that we should find money for, Madam Commissioner. You were quoting many negative cases where people were dying alone, but I would like to give you a very positive example from a care house in Bochnia in Poland, where there was a coronavirus cluster and detected, and there were not enough people, and at the same time volunteers, the Dominican nurses who used to work there over a long time and who were helping these people, they came to help. So we should appreciate such people like these Dominican nuns. We had many such cases, many such examples in Poland. Thank you.
Mrs. Lexman, 1 minute and a half.
Commissioner, colleagues, the pandemic that hasn't yet finished has shown the great vulnerability of the long-term system of care for the elderly and people with disabilities. We've witnessed situations where many clients of such facilities died because of the coronavirus, because there wasn't sufficient access to protective equipment, safe isolation of the sick, or testing. All these shortages, including insufficient support to these facilities, should be thoroughly examined. The pandemic has also proven that repeated calls for deinstitutionalization of long-term care facilities are more important than ever. Smaller family-type facilities would improve the client's chance for a good life, and they would be more resistant against epidemiological crises. In the near future, we need to focus our efforts and our resources to achieve this goal. In order to complete the community care system. Last but not least, the pandemic has shown us a mirror. We are witnessing lack of respect towards the elderly or people with disabilities. The level of a society is measured according to how it treats its most vulnerable. The pandemic has shown that our society has to try a lot in order to fulfill the values that we claim. Thank you.
Mr. Czarnecki, 1 minute.
President, ladies and gentlemen, there are different countries and societies. We've heard a colleague from the EPP talking about people not being sensitive anymore. Well, I have the impression that the Polish society has reacted in a very thoughtful and humanitarian manner, which was just mentioned by Mr. Yaki a while ago. Member states reacted in different manners. Some were quite reckless. Others, including Poland, but not only, reacted in a very thoughtful manner. Therefore, in Poland, the number of deaths was 20 times smaller than in Belgium, the host country here. I am impressed by what was said by the colleague from Spain, and I hope that other members from Spain will make reference to it as well. Several scenarios took place in Belgium, and The European Union failed to react, people said. It is a fact, yes, but in European treaties there is no provision about health being covered. Right of law is not there either, so it's another peak of hypocrisy. Thank you.
Mr. Fernandes, 1 minute and a half.
Thank you very much, President, Commissioner, colleagues. There are deaths in the old people's homes of the European Union. In my own country, Portugal, these are deaths that could have been avoided. Either there was incompetence or there was inertia on the part of governments. There can be inertia at the European level, but the European Union has the member state level, but the European Union has a responsibility to coordinate. The Commissioner's words give us hope. We need coordination in the healthcare sector, but at the same time, we need a real plan to try and combat solitude in the European Union, loneliness. There are excellent healthcare professionals out there. There are excellent professionals that work in long-term care facilities of various kinds. But there are real challenges out there. In the near future, member states will be receiving billions of euros from the recovery fund. It's essential for us to use that money properly to protect the most vulnerable in our societies and to help those who need it most. We need to ensure that the member states who receive those funds should have a clear objective. The average age in Europe is 44. The trend is for that to increase. It's a fact that obliges us to act. We need to provide quality care, and this will last for much longer in the future.
Mrs. Glavak, 1 minute and a half.
Thank you. According to the ECDC data, 30 to 60% of all people who died of COVID in many European countries were residents in long-term care facilities. Many people in need of long-term care have been isolated in nursing homes for weeks, and this has resulted in reduced social contacts, disrupted routines, fear and anxiety. Because we wanted to protect them, they have been excluded, socially isolated. Loneliness and exclusion are particularly stressful for them. Their generation, after all, does not live in a digital world. The WHO report on the impact of COVID-19 is very worrying, as it shows that violence against the elderly has skyrocketed since the outbreak. We have to encourage member states to provide mental and emotional support, psychosocial support, and also financial support. We have two often mutually exclusive goals in a new challenge that we face: how to reduce social isolation yet save lives. I hope that the European Commission will have that in mind in drafting its green paper on ageing that you mentioned in your remarks, Madam Vice President, and that the Commission will consider the adequacy of social care system, active ageing policy and long-term care policy. The way we care for our elderly citizens will hold up a mirror to our humanity, after all, because you and I have grown older since yesterday, and tomorrow we will be the very same people we're talking about today. Thank you very much.
Mr. Lucien, 1 minute and a half.
Thank you, President. Madam Commissioner, the situation is dramatic in many care establishments and old care homes, especially in my country, Belgium. So there's a question for us, the question of the place of elderly people in our society. And we could put in place measures in member states, but also at European level, so we can support loved ones, give them more recognition, respect the freedom of choice of old people to go or not to go to care homes, family aid to support all the actors within health, to give the possibility to old people so that they can stay at home and preserve their life. That's important within a more global strategy which we could develop at the European level. The level of people in old care homes is rather high. they're in these homes because we haven't looked at all the range of actors who are looking after these people, helping them to stay at home. So there's this freedom to live at home. We can't isolate care homes. We need to see this in the bigger picture and have more broader-based view of older people and their loved ones and supporting them to live at home. Thank you.
Mr. Sokol, 1 minute and a half.
Thank you. As I was doing some research on the data underpinning this debate, up to 60% of people who died of COVID in the European countries were residents in long-term care facilities. This is terrible. But the thing that is even more terrible, as we have seen in this debate, it's the differences between member states in the level of service and how the services are provided. We have heard from our colleagues that this is not in the competence of the European Union. It is partially true, because there is a recovery fund, and the consequences of the pandemic can be used to deal with this. And we also can use the European Social Fund to finance the education of carers. So there are financial instruments that the European Union can use to reduce the differences in the quality of long-term care. And finally, we have the European semester, which controls whether the European member states have met the standards that have been set. So the European Union can contribute to improving the quality of long-term care and can thus show that the lives of all EU citizens is worth the same. And I'm happy that the European Commission, including through the portfolio of Commissioner Suica, has shown that this is indeed the case, because after all, we will all grow old and we have to show that all lives of all EU citizens are equal. Thank you.
1 minute.
Thank you, President. Across the European Union, to date, 3.7 million people have been infected with COVID-19 and 200,000 have died. And these numbers continue to grow. These are like the statistics coming back from a battlefield, and the statistics tell us that in many cases the facilities that look after old people and the disabled are clusters for the virus. The staff have in many cases risked or even lost their lives to save those of others. We have to analyse this data to understand what kind of critical points have increased the risk of contagion in these kinds of facilities. We cannot consider these to be a second-rate priority. It's our duty to have a plan to revise procedures in these kinds of facilities. We have to imagine new protocols to better protect people who are vulnerable and allow the healthcare staff to have the best possible guarantees if a new wave of COVID creates a similar threat. We can't afford to be unprepared again.
Mr. Manders, 1 minute and a half.
Thank you, President. I would like to compliment Commissioner Suica on her honesty in describing the state of affairs in her opening statement. COVID hit us hard. We have seen many victims of COVID and victims of the neoliberal system. We've seen older people, the more vulnerable, stuck in a corner, ignored by society. Now, I noted the Commissioner's pledge to look at care facilities and bring about an improvement. I hope that there will be a single market in care services, that we look at the skills required for carers. I hope that we will also have a minimum price throughout Europe for medicines and medicinal products. We want people to be healthier. You know, 50% of our population are over the age of 50. So we want a healthy society. That is key. We should not exclude and isolate older people. We've seen the problems that result. A journalist in the Netherlands described this situation, pointed out that this was a huge scandal. I believe that journalists, as opinion formers, should also report the truth of all people in society. Thank you.
Now I give the floor back to Commissioner SUICA. Madam Vice President, the floor is yours.